Welcome back. You're watching K24 Weekend Edition. It is now time for our lifestyle interview. Now, this week marked the Global Breastfeeding Week, and this is what we are discussing in our lifestyle segment today. We're looking at this in a Kenyan context. What challenges are we facing when it comes to mothers breastfeeding, and what more needs to be done? Well, let me just introduce our guests once again. We have Faith Mwaura, who is a mum and the founder of an online platform called Kenyan Mums, which provides support to mothers when it comes to breastfeeding as well as general parenting. We also have Elizabeth Kimau, who is a research scientist at the African Population and Research Center, focusing on nutrition. And of course, we have Gladys Mugambi, who is the head of nutrition at the Ministry of Health. Ladies, welcome to the show, and thank you so much for being here. Elizabeth, let me start with you. Let's discuss the short and long-term benefits associated with breastfeeding exclusively. Now, this is, of course, occasioned by the global attention that has been brought to breastfeeding. We've seen with this week being the Global Breastfeeding Week. So why is breastfeeding necessary, and what is the ideal time frame that mothers should exclusively breastfeed?
Breastfeeding is very important for the child and also the mother, long term and short term. For the breast milk has all the nutrients that the baby needs, like also the immunity that the baby needs when the baby is still young. So it protects the children from getting sick. So children who are exclusively breastfed for the first 6 months are less sick. That's what evidence shows. And for the mother, it also protects them from like ovarian cancer. It gives them many other benefits. For the child, again, it protects them from getting like obesity later in life. So it's not just for now, but even later in life. And it's also good for survival of the baby. It protects against deaths. Like research has shown that about 13% of deaths, child deaths, can be prevented by if you do exclusive breastfeeding for the first 6 months. And recent research has also shown that actually breastfeeding is associated with IQ and also income later in life. Like children who are breastfed for a longer time when they are still young have higher IQ later in life, and they actually have higher income later in life. So we are saying that it's actually good for the whole nation, because economic productivity is improved if you do breastfeeding or exclusive breastfeeding and extended breastfeeding for 2 years and above. And so the ideal time for exclusive breastfeeding is 6 months. That's what research has shown, that if you do exclusive breastfeeding for the first 6 months, those benefits, it's associated with those benefits, and the child will grow well and children will survive. And yeah, that's basically that.
Well, that's very interesting and useful information there that you've given, quite vast benefits that you've outlined there associated with exclusive breastfeeding. Gladys, you're the head of nutrition with the Ministry of Health. Now, if we look at the Kenyan context, we've seen remarkable growth in exclusive breastfeeding. Some statistics here indicate in 2003, 13% of mothers were exclusively breastfeeding. 2015, 61%. So that's a remarkable growth. How have we been able to achieve that in the Kenyan context?
I think we've had to put in place several measures. One of the things that I think is key is that we've created awareness. In the last 5 or so years, we've been doing a lot of campaigns every year. We do talk about breastfeeding, and I'm happy that it goes up to the county level. And to add on that, we are trying to ensure that all our hospitals are baby friendly. What it means is that the mothers, as they go to the hospital to the antenatal clinic, they're getting information. And when they give birth, the baby is put on the breast immediately, and they're told why. Then they continue getting information on what they should do so that they can ensure that breastfeeding continues. That means then our hospitals are baby friendly. We are trying to ensure that that happens, and then there is the information with the health workers so that they are able to advise in the right way. And we are going further to have what we call community baby friendly initiative, whereby at the community level, the members of the family and the community are also aware that breastfeeding is important. They're able to support the mothers and also provide what is required. Especially at the family level, the mother requires support from the members of the family, the caregivers. The mother is also expected to have time to be able to breastfeed and also fed well. The mother should feed well so that she's able to breastfeed. So those are some of the initiatives, and we continue with the messages.
Okay, all right. Well, that's fantastic information there. You're just outlining that it's been an aggressive initiative to increase awareness in a holistic way. All right, Faith, you're a mother, and so I'm very keen to get your input on this discussion. Tell us about your experience when it comes to breastfeeding, and also in line with the platform that you have, Kenyan Mums. Tell us why you started it and what sort of support that this online platform provides for mothers.
When I gave birth, there was not so much information, Kenyan information that you could get out there that as a mom would work for you. For example, what foods to eat to increase breast milk, how to take care of yourself as a Kenyan mom. And so that's why we decided to just form a platform where moms can be able to get this information that is very Kenyan. My experience about breastfeeding, one, I had to quit my job because I didn't have as much milk to be able to express and breastfeed for 6 months. So that meant I had to stay with my baby to be able to exclusively breastfeed for 6 months. Two, I realized that breastfeeding is not natural, and it can be so frustrating, especially for a first-time mom, because you're feeling like this thing should just happen, but it doesn't happen. And so that's you need that community, you need that support from other moms who tell you, actually, I also had a hard time, but I overcame. I also went through the same, and I managed to exclusively breastfeed for 6 months. And so that's why because it's something that I really believe in, I thought maybe having a platform where other moms can be able to engage and get help, because we're not in the old times where my mom can come in and live with me and encourage me for the entire 6 months. And so she'll probably be able to come for 2 weeks and she's gone. So what happens after she's gone? We're no longer in the society where there's so much help, and as long as I'm on my phone, I can be able to reach another mom who will tell me, okay, just relax, do this, and you will get all the help that you need. And so that's why we decided to form a group where moms can just get that support.
Okay, all right, fantastic. Thank you for sharing that. I'm sure that online platform is a community providing a lot of information to mothers in the same situation around that. Okay, Gladys, back to you again with the Ministry of Health here. You had mentioned some of the initiatives, and I'd just like to touch on them again. Now, there's the baby-friendly initiative, hospital initiative, and then there's also the baby-friendly community initiative. Tell us a little bit about these initiatives and what they have set out to achieve and how successful they've been in achieving what their goals are.
Okay, in hospitals where the health workers are aware about breastfeeding and its importance, you'll find that there are messages all over, and they should provide messages to mothers like her. If she went to the hospital, she would get that information. Then in those areas where we have managed to continue with the baby-friendly hospital initiatives, you'll find that mothers know where to get the information, and they know who to go to. And baby-friendly community initiative is just starting. We've had a few counties implementing it, and we want to scale up to ensure that every community has community health workers who are able to support mothers in the rural areas. When they have problems with breastfeeding, they're able to get somebody to help them. The problem that she's sharing, whereby she feels like breastfeeding is not natural, it should actually be natural. The milk should just come, But there could be issues that make our mothers not to breastfeed. And therefore, you'll find that people are trained at the community level and they're able to help these mothers like her to continue breastfeeding. They really don't have to wait for the grandmother or the mother to come around and stay with them. They should get that support from the people who are sitting with them every day.
All right, so a lot of support for mothers, both on a hospital level as well as community level. That's, I'm sure, played a very big role in increasing the statistics that now inform breastfeeding in Kenya. Elizabeth, let's talk about how Kenya has been able to achieve these growths. It's fantastic. We've seen it go from 13 to 61%, but more still needs to be done. And so on that point, I'd like to look at some of the challenges that Kenya faces in a Kenyan context, as well as mothers face. So what are some of the challenges that you might have come across, particularly from your research?
Yeah, we've done research amongst women in different contexts, women in the middle income and women in lower income and rural and urban, and we've seen that both groups, all those groups, they actually have challenges. In the urban poor settings, we have women working, if those who work, they work as casual laborers and they don't actually benefit from maternity leave. So, and you know, they earn very little. So by the time when they give birth, they don't have much they have saved during, like, when they were pregnant. So they don't have any reserve for which they can depend on. So they have to look for work again. And when they look, even after 1 month, they have to go looking for work. So they are like maternity leave, you can say it's like weeks or just a month. And so when they go back to work, the conditions at work, they don't allow them to breastfeed, so they can't carry the baby to work, and so they can't continue exclusive breastfeeding, because again they are in a poor setting and they don't have fridge, and they say that they can't express breast milk and leave it at home because they think it will get spoiled, and they don't have a lot of support. And then for the middle income woman, it's similar kind of situation, but they have maternity leave. But they say that when they go back to work, before they go back to work, before the 3 months are over, sometimes their employers are asking them to do some work, or they call them back to work. But even when those who still go for 3 months, when they go back to work, the workplace is not conducive for breastfeeding, because sometimes they don't have facilities for expressing breast milk, or the child, they can't carry the child to work because there are no such facilities where you can carry your baby to work, and so they can't continue expressing breast milk. Some of them try, and they do it some in like unconducive places like toilets, and sometimes they say they give up because it's not conducive, and the work environment, people don't support them. People, once you get back to work, people think you should just continue to work as it was. There is no like flexi time or breastfeeding breaks like it's recommended in the ILO. Like the Maternity Protection Convention recommends that women are given flexi time where they can go back home, like they can work like part-time and go back home and breastfeed. And it also recommends breastfeeding breaks, and those don't happen in many of the organizations that we are working in, because like in the Kenyan law, it's not provided for. So those are some of the challenges. In the rural settings is the same, but one of the key challenge that goes across all the groups is also support at home. Women are not getting the support that they should get at home. Their husbands or the people, they don't have enough people around them to support them, like do chores. So they have to do a lot of work and then breastfeed. And you know, breastfeeding is a hormonal process. If you are stressed up, so they get stressed up by work. And if you are stressed up, the milk does not flow as it should. So those are many challenges. And as she said also, we say breastfeeding is a natural process, but it's really difficult. Women have told us that it's really difficult to breastfeed. Even I know of a doctor who told me she has been telling people how to breastfeed, how to do all those things, latching and all that. But when it came to her turn, she actually found it was so difficult that she used to have all those issues that women have, engorged breasts, they have sore nipples, they can't breastfeed, and women need a lot of support, even professional support, so that they know how to do how they should do it, latching, breast positioning, so that the baby breastfeeds the right way, so that they don't have those breast conditions that women have and which discourage them to continue breastfeeding.
Okay, fantastic. Thank you. A lot of information there. If I just try break that down, one of the themes of this year's Global Breastfeeding Week was breastfeeding at work and the challenges faced there. Now, Faith, I know that you mentioned that you had to, in fact, leave your workplace. Have Your Say question tonight is asking, should the maternity leave period in Kenya be extended to 6 months to allow for exclusive breastfeeding? So, Faith, what do you think? Do you think it should be extended to 6 months? And what more needs to be done to encourage breastfeeding or an environment in which mothers can continue to breastfeed at work? Is it facilities? Is it a time period? Is it breaks, as she's saying? So what do you think needs to be done, and what's your personal experience?
I think a lot needs to be done. But if I look back, had my times at work been more flexible, I'd probably have stayed at work. But I had to be at work at 7 a.m. and I'd leave at about 5:36. So that meant I wouldn't be able to take care of my baby or even breastfeed as well. And so that's why I had to quit my job. So that's one of the things that can be done is, one, the hours can be adjusted. If you're not able to get the 6 months, then your hours are adjusted. So you probably get into work at 8 and leave a bit early so that you can be able to spend more time with your baby and be able to breastfeed better or more. 2, the time can be moved to 6 months, which I think is every mom's dream, because when it's 3 months, you're thinking, what is 3 months? It's 3 months already. I have to go back to work. I don't think my baby is able to cope without me.
So you think it should be extended?
Yes.
Okay.
And or the third one would be create spaces where moms are able to express, like she mentioned.
By law.
Yes. Just have a space where moms can go sit, express, have a space where they can keep their milk, and home time they go home and they have enough milk for their babies. Because I don't think every employer would probably be able to give 6 months off.
Okay. Yeah. All right. Fantastic. Thanks for that. As we run out of time, I just want to get closing remarks from each of you. So Gladys, working with the Ministry of Health, I'd like to direct this question to you. Now, although we have made progress to 61% penetration when it comes to mothers breastfeeding, what more needs to be done to safeguard the rights of mothers, particularly when it comes to law enforcement? What does the government need to do in terms of initiatives, as we said, in regards to employers supporting breastfeeding, and also labour laws, as Elizabeth mentioned, for the informal sector?
I think we've identified some of the areas where we need to improve. We know there are mothers who are working in the informal sector, and we request the employers to put in place measures that will make sure the mothers are, first of all, not working in stressful conditions. They have space where they can be able to express milk if they have to continue working. Then they have time off to be able to go and attend to the babies. And then they support. That mother needs support even at the workplace. And the issue of mothers who are not able to get leave for 3 months, I know it's because of the laws whereby if you work for a month, for those who are casual workers, then you have to renew your contract. They don't have leave. Such employers should really take into consideration that pregnancy is actually a good thing, and they should support these mothers.
Will the government be doing more to make sure and ensure that these employers respect the rights of women?
Yes, we'll continue creating awareness. We've had workshops and we want to continue having them. And some companies are already implementing that, like where we launched this year's World Breastfeeding Weeks, Safaricom, and other organizations. they have space for the mothers.
So more organizations need to follow suit.
Need to do
okay, sorry to cut you off there. We are running out of time. I just want to get Elizabeth's closing remarks here. You are a research scientist and you really specialize on nutrition. So in as few words as you could muster together, what advice would you give to expecting mothers or mothers who have already given birth when it comes to breastfeeding and nutrition?
It's just the same thing that they should plan very well, so that they put it in their head that they need to do like exclusive breastfeeding for 6 months and extended breastfeeding for 2 years and or beyond. So they need to plan it in their head and even physically that this is what they need to do, so that they do the preparations that they need to do. So if it's a working mom, during the 3 months of maternity leave, they need to start like expressing breast milk and storing it, because it can be stored. If it's frozen, it can be stored for a long time, and so that milk can help, because when they go back to work, they may not be able to express as much as they would when they are on leave.
And what about dietary? What should they be eating? What should they be intaking to continue lactating?
Okay, in terms of diet, we talk of a balanced diet. Okay, we've had many people like our grandmothers or people like those telling us what we should do, the porridge and all that, but what we advise people to do is a balanced diet, and to there are guidelines on how the portions that women should take. Maybe that's a discussion for another day. So they should also seek professionals' advice, so that they can know in what proportions, like, so they don't have to eat too much. They eat in the right proportions and the right frequency and the right amount of like fluids, but they not to just eat like, say, porridge and so much porridge of it. So because it has also...
consult a doctor and a medical professional in terms of what dietary requirements you should be intaking at what intervals.
Yes.
Okay, fantastic. As we wrap up here, Faith, what are your final comments as a mum, also in regards to your support platform? What would you say to mothers when it comes to breastfeeding?
Get a support group. Get a support group. Be it a WhatsApp group that you will form with fellow moms, be it on social media, be it a mom that you can always call. Make sure you get support, because it takes a village.
Okay, all right, fantastic. Ladies, thank you very much for coming into studio, for engaging in this discussion, a very relevant discussion on the issue, and we do hope that this has been informative to you at home.